The right and left hip bones are two irregular-shaped bones that form part of pelvic girdle. The hip bones have three main articulations: sacroiliac joint, articulation with the sacrum; pubic symphysis, articulation between the left and right hip bones; hip joint, articulation with the head of femur. In this video, we shall look at the anatomy of the hip bones, their composition, bony landmarks, and clinical relevance. Composition of the hip bone. The hip bone is comprised of the three parts, the ilium, pubis, and ischium. Together, the ilium, pubis, and ischium form a cup-shaped socket known as the acetabulum. The head of the femur articulates with the acetabulum to form the hip joint. Prior to puberty, the triradiate cartilage separates these parts, and fusion only begins at the age of 15 to 17. We shall now look at the individual parts of the hip bone and their respective bony landmarks. The ilium. The ilium is the widest and largest of the three parts of the hip bone and is located superiorly. Immediately above the acetabulum, the ilium expands to form the wing or aula. The wing of the ilium has two surfaces. Inner surface has a concave shape, which produces the iliac fossa, site of origin of the iliacus muscle. External surface, gluteal surface, has a convex shape and provides attachments to the gluteal muscles. The superior margin of the wing is thickened, forming the iliac crest. On the posterior aspect of the ilium there is an indentation known as the greater sciatic notch. Clinical relevance. Anterior superior iliac spine. The anterior superior iliac spine, ASIS, is an important anatomical landmark, midinguinal point, halfway between the ASIS and the center of the pubic symphysis. The femoral artery can be palpated here. In clinical practice, a patient's true leg length is measured from the ASIS to the medial malleolus at the ankle joint. The pubis. The pubis is the most anterior portion of the hip bone. It consists of a body, superior ramus, and inferior ramus, ramus equals branch. Pubic body, located medially, it articulates with the opposite pubic body at the pubic symphysis. Its superior aspect is marked by a rounded thickening, the pubic crest, which extends laterally as the pubic tubercle. Superior pubic ramus extends laterally from the body to form part of the acetabulum. Inferior pubic ramus projects towards the ischium. Together, the superior and inferior rami enclose part of the obturator foramen, through which the obturator nerve, artery, and vein pass through to reach the lower limb. Clinical relevance. Pubic rami fractures. Pubic rami fractures can sometimes be observed on X-rays in elderly patients who are investigated after falls from standing height. These fractures are usually treated without surgery. Healing can be expected within 6 to 8 weeks. The ischium forms the posterior inferior part of the hip bone. Much like the pubis, it is composed of a body, an inferior ramus and superior ramus. The posterior inferior aspect of the ischium forms the ischial tuberosities, and when sitting, it is these tuberosities on which our body weight falls. Near the junction of the superior ramus and body is a posteromedial projection of bone, the ischial spine.